Good evening, everyone. So yesterday we all had a session on the theory portions of community medicine. Today we'll see some around almost 100 MCQs from the uh, subject. It's not in any particular order. We have just given random MCQs and we will be discussing each and every portion from that. So we'll start with the first question. Safe yield of a water supply source is the yield that is adequate for option A 80% of the year, option B 90% of the year, option C 95% of the year, and option D the whole of the year. So the question is, the safe yield of a water supply source is the yield that is adequate for. Means a water source is said to be safe if it is adequate for. If it is adequate for which of the following? Please answer the chat box. I'll be waiting. And while you people are answering, we'll just deal with the main topics over here. So first one is safe water. So safe water, there are a few points in that which may be asked in the exam. So I'll just jot it down here. So first one, it should be free from any pathological agent or any harmful chemical substance, free of any pathological agent or any harmful substances. Next one is pleasant to taste. It should be pleasant to taste. Next one is the last point, which is it should be usable for domestic purposes. Usable for domestic purposes. So these are the 3 points which comes under safe water. Now the next point over here is the water source. The water source, it can be 4 types, which are the pipelines, the piped drinking water, the hand pumps, then comes the wells, then the surface water. Surface water means the river, the lakes, etc. So I am waiting for the answers over here. The safe yield of a water supply source is the yield that is adequate for option A 80% of the year, option B 90% of the year, option C 95%, and option D the whole of the year. Which is the right answer here. So here the right answer is C, 95% of the year. So a water source is said to be safe if it has a yield for 95% of the year. So C is the right answer here. So moving on to the next question. Yeah. Minimum depth of the lining of the sanitary well. What is the minimum depth of the lining of a sanitary well? Option A, 10 feet. Option B, 20 feet. Option C, 35 feet. Or option D, 50 feet. Which is the right answer here? This is a direct question. While learning about sanitary well, it is always asked directly. Which is the minimum depth of the sanitary of the lining of the sanitary well? So I'm getting answer like B, 20 feet. The sanitary well, we all know the lining is 6 meter. So while converting into feet, it will be almost 20 feet. So the right answer here is 20 feet. B, 20 feet. Yeah, I've got the answer. Yeah, that it is 20 feet. Other points from sanitary well, the other numericals from sanitary well is that it should be 15 meter away from the contamination. If any contamination source is there, it should be 15 meter away. That is one numerical. The next one is that the platform of sanitary well should be 1 meter in all direction, and the parapet wall should be 70 to 75 centimeter. These are numericals which can be asked under sanitary well. So the minimum depth of the lining, if it is feet, it will be 20 feet, and if it is meter, it will be 6 meter. Moving on to the next question. Screening test specificity is the ability of a test to correctly identify option A, false positives, option B, true positives, option C, true negatives, and option D, false negatives. So which is the right answer here? Screening test specificity is the ability of a test to correctly identify true positive, true negative, false positive, or false negative. Which is the right answer here? The question is about specificity. I'm getting answer like C. True negatives. True negatives are the majority answer. We'll see. About screening test, we need to know, first we need to know what are these false positive and false negatives, all these things. So false positive means the person who is screened, he has the disease, but sorry, he doesn't have the disease. Disease is not there, but the test is positive. Test is positive means the test is wrong. Even though the patient is not having the disease, the person is having the positive test. True positive means he has the disease and he is showing positive result. True negatives. True negative means the person is not having disease and the test is also negative. False negative means the person is having the disease. The disease is there, but the test is showing as negative. These things are mainly used in present scenario in case of this COVID issue. So sensitivity. The question was asked about specificity. Specificity is identifying those people who does not have a disease. So here, the people who are not having disease, that is true negatives. True negatives are the right answer. As you all said, true negatives are the ones which has to be identified in a screening test to understand if it is specific or not. So right answer is C. Moving on to the next question. Which of the following is not transmitted by lice? Which of the following is not transmitted by lice? Q fever, trench fever, relapsing fever, or an epidemic typhus? Which is the one which is not transmitted by lice? Q fever, trench fever, relapsing fever, or epidemic typhus? Please answer the chat box. This is not a louse or lice-borne fever. Lice is the question. Is it Q fever or trench fever or relapsing fever or epidemic typhus? I started getting answer. Like it's a yeah. Majority are saying Q fever. Yes, the answer is Q fever. Now here the other ones is Q. What is the vector for Q fever? Even though Q fever is a zoonotic disease, it does have an insect vector. Even though it is a zoonotic disease, it does have an insect vector. But which is the insect here? Q fever is transmitted by tick. It is transmitted by soft tick. There are two types of tick, hard tick and soft tick. So Q fever is transmitted by soft tick. Now trench fever. Trench fever is, as the question is there, it is also lice-borne fever. Relapsing fever is also lice-borne fever, and epidemic typhus is also a lice-borne fever. Now there are other types of typhus. It is scrub typhus. Then there is endemic typhus. Then there is something called tick typhus. So these are also called typhus, but the vectors are different. Tick typhus, as the name suggests, it is transmitted by tick. Endemic typhus, it is transmitted by flea. Scrub typhus is transmitted by mite. So remember, this portion of community medicine is very much important, as the questions are sure from these portions, which is not transmitted by tick or. So you should know which disease is transmitted by which vector. So as you all have said correctly, the answer here is Q fever. Now moving on to the next question. All are true about randomized control trial except RCT, randomized control trial. All are true except first one, baseline characteristic of intervention and control groups must be similar. Option B, investigator bias can be minimized by double blinding. Option C, the sample size depends on the hypothesis tested. Option D, dropouts should be excluded from the analysis. Which is the right answer here? So remember here it is all are true except means which is false among these statements. I'm getting mixed answers. So here, see the control groups and the control groups and the intervention group should be similar. That we all know. It has to be similar. Then the investigator bias can be minimized by double blinding. That is also right. To include to exclude the bias, double blinding is done, which was taught in yesterday's class. And the next one, the sample size depends on the hypothesis strength. So many of us, while doing the internship, we have been formulating the hypothesis and based on those hypotheses, we have formulated the sample size. Now the wrong statement here is option D. D is the right answer here because dropouts are not excluded from the analysis actually because dropouts has to be included to prevent the error. It has to be included to prevent the error in the final analysis. Now moving on to the next question. Non-deliberate cultural practice with anti-mosquito effect is. Which among these are a non-deliberate practice? First one, use of mosquito repellents, use of bed nets, use of alkaline detergent for washing clothes, or use of larvicides. Which among these is a non-deliberate effect as an anti-mosquito practice? Which is a non-deliberate practice. Is it using of mosquito repellent or using of mosquito nets or bed nets, using of alkali detergent for washing clothes or use of larvicides? Which is the one which we did not deliberately do to prevent or to kill the mosquitoes? Which is the right answer here? Yeah, I'm getting answers as use of alkali detergent for washing clothes. Yes, that is the right answer because all the detergents which is available in the market, most of them are alkali based. And alkali based detergents help in killing the mosquito larvae. We do not deliberately do this, but it it helps in the mosquito killing and controlling the diseases. And use of mosquito repellents and use of mosquito nets and the larvicides are deliberate measures. We knowingly do that to kill the mosquitoes. Next one, next question. This is an application kind of question. This can be asked. So I have just included this one here. Using a new technique, the hemoglobin was estimated in a blood sample. The test was repeated for 10 times. The reports were like this 9.5, then the next test 9.2, 9.4, 9.6, 9.7, 9.9, 10.2, 10.3, 10.5, and 12.1. The accurate value of the HB was estimated by standard test as 10.2. 10.2 is the accurate value. So, according to this estimation, the new technique which was used, what does it have? Does it have a high validity and high reliability, or a low validity and low reliability, or a high validity but low reliability, or a low validity and high reliability? Which is the right answer here? So here the correct hemoglobin concentration is 10.2. But according to the new technique, all these results were obtained from 9.5 to 12.1. So quite a variable values. So according to this, which is the right answer? Now all these are getting answers. Exactly. This new technique has low validity and low reliability because only three times the test showed to be accurate, like almost accurate to the correct value of the hemoglobin, but and it had a large variation from 9.5 to 12.1. So it is a large variation, so it cannot be relied on, and it is not valid in estimating the hemoglobin value. So that is the right answer here. It has a low reliability and low validity. So next question. Modes of disease transmission by vectors are all except regurgitation, biting, ingestion, or rubbing of infected excrement. Which is the right answer? Which is not a mode of transmission by vector. Regurgitation, biting, ingestion, or rubbing of infected excrement. Even if you have not read the subject, you can answer this by use of logic. These vectors are the people who transmit the disease. They are not the cause of the disease. So, how can the vectors transmit? It has to take from one point of source to and transfer to the other point source. So, if the vector eats the drink, if the mosquito drinks the blood from one person and then goes and bites the other person, there is a point of regurgitation here. Thereby, it is transmitted. It bites, not regurgitation, it bites the other person, and thereby the saliva mixed with the disease, the pathological agent is transmitted. That is biting. So biting is not the answer for this one. And regurgitation. In case of house flies they go and regurgitate the things whichever they eat something and then go and regurgitate. So thereby transmit the disease. And rubbing on rubbing of infected excrement in case of in case of rats or rodents, they go and rub on the things, thereby transmit the disease. And the next one, the right option, as you all have said, it is C, ingestion. Here they're just eating it, and after eating, they're not regurgitating it back. So here this is not a right answer. So moving on to the next question, which is not a synthetic pyrethroid. Which is not a synthetic pyrethroid? Option A, DDT. Option B, proparthrin. Option C, cypermethrin, or option D, permethrin. Which is not a synthetic pyrethroid. Now you need to remember one thing here. Pyrethroid is actually a compound of pyrethrin. So this will give you a clue to answer this question. Pyrethrin is a naturally occurring compound, and pyrethroid is like pyrethrin-like compound, so which is not a synthetic pyrethroid. So here you can see all the options other than DDT have this thing in common. So as you all have studied in chemistry, so from this you can understand that DDT is the right answer. DDT is dichlorodiphenyl trichloroethane. So no form it is related to pyrethrin. So it is the right answer here. So DDT is dichlorodiphenyl dichloroethane. So basically it is a organochlorine compound, not a pyrethroid. No, other three are a synthetic form of pyrethroid. Moving on to the next question. Mass prophylaxis in endemic areas is given for all except option A, leprosy, option B, yaws, option C, trachoma, or option D, filariasis. Which is the right answer here? Mass chemoprophylaxis in endemic areas. Mass chemoprophylaxis is a form of secondary prevention. So, which is not the correct answer. Which is not the disease condition where mass chemoprophylaxis is not given. Sorry. So I'm getting answers like leprosy here. So we all know trachoma, yaws, and filariasis is a condition where they give some or other kind of medicines or drugs as a prophylactic remedy. But in case of leprosy, there is no such medications given for the entire population in endemic area to prevent it. So, as you all have said, as many of you have said, leprosy is the right answer here. Leprosy is the disease where mass prophylaxis is not given. Now, many of you have answered. Next question. JSY. It is a very much common question. We all have learnt in our UG also. And this is many a times asked in or many of the exams in the PSCs and the AIPGT PG exams also. JSY, what is the full form of JSY? Is it Jani Suraksha Yojana, or is it Jeevan Suraksha Yojana, or is it Jeevan Shakti Yojana, or Jan Suraksha Yojana? It is very much easy to answer. Yes, many of you are answering. It is Janani Suraksha Yojana. Janani Suraksha Yojana, as the name says, it is for the mother, the health of the mother. And it was launched in the year 2005. That you have to remember. For lowering the maternal mortality rate and infant mortality rate. by preventing the home deliveries and encouraging the institutional deliveries as in the hospital deliveries. So this is the right answer. Many of you have correctly answered. Next question. A case of acute flaccid paralysis should be kept under surveillance for residual paralysis for how many days? Is it 30 days or 45 days or 60 days or 90 days? For how many days the should a case of acute flaccid paralysis should kept under surveillance? Please answer, which is the right answer. Even if you don't know the answer, you can just guess work over here, because now if you do guesswork, you can just correctly and surely answer in the exams. I've got answer like 60 days. 60 days is the right answer. Exactly, 60 days is the right answer. In case of acute flaccid paralysis, surveillance should be kept in case of for residual paralysis for at least 60 days. Right, that is the right answer. Some of you have answered correctly. We'll move on to the next question. There is nothing much to explain over here. Next question. Movement across the socio-economic levels is known as movement across the socio-economic levels is known as social insurance or social mobility or social equality or upliftment. Which is the right answer here? The social insurance is the social mobility or social equality or social upliftment. If you just use your logic here a little bit, you can answer here. Movement, which is the other name for movement, mobility. So that is the only term which has movement related thing here. So right answer here is social mobility. Yes, you people are answering correctly. The answer is social mobility. Social mobility, extra things you need to know is not only in the basis of income, it is also it is based on the socio-economic status. Socioeconomic status, even if the person goes from higher socioeconomic status to low, or vice versa, even if they can go from low to high, it is termed as social mobility. It can be because the person has started getting higher income or started getting lower income, or in case of literacy or job opportunities. Any change in these things, they can move from the move from lower socioeconomic status to the higher socioeconomic status, or vice versa. So this is the right answer. The right answer is social mobility. The next question: true statement about Himalayan goiter belt. Which is the right statement here? First one, it is 2,400 km wide. It is the largest goiter belt in the world. Option C extends from Kashmir to Naga Hills. Option D, all of them. Which is the right answer here? Yeah, I've got a request asking to speak in Hindi. The thing is, we are having people from different parts of the country, and it will be difficult for some others if I start speaking in Hindi. So here on after, I'll try using little more simple English, so that and it will be easier to understand. And moreover, the exam is going to be in English only. So, and I'm not going to explain in detail about the subject. So Hindi won't be that much needed, I think. And still, if you're having any issues, you can just tell us. We'll try to modify in the further classes. So yeah, exactly. Many of you have answered it correctly. This question. Himalayan goiter belt is 2,400 kilometer wide. It does extend from Kashmir to the Naga Hills, and it is in fact the largest goiter belt in the world. So the answer is D. All of them is the right answer. We'll move on to the next question. Okay. The usefulness of a screening test in a community depends on what? Sensitivity, specificity, reliability, or predictive value. Which is the right answer here? The usefulness of a screening test. Please answer in the chat box. I'll be waiting. As many of you have been answering, the answer will be sensitivity, because specificity is not that important in the screening test. We can sensitive screening test is done just to see if the person is having a disease or not. Specificity if is like we are trying to see what kind of disease and going on to the specific details of it. That is not important in case of screening test, as we can confirm by using other confirmatory test. So here the right answer is exactly A is the right answer. Sensitivity is the important thing for a screening test. Now, going on to the next question. Multi-purpose worker scheme in India was initiated following the recommendation of which committee? Srivastav Committee, Bhor Committee, Kartar Singh Committee, or Mudaliar Committee? Which is the committee which suggested the multi-purpose worker scheme? Remember, it is not the suggestion of multi-purpose worker, but the scheme. It is asking about the scheme. It is the right answer here. The Srivastav Committee, or Bhor Committee, or Kartar Singh Committee, or Mudaliar Committee. This was also dealt with yesterday when ma'am was talking about the different committees and the national health programs and everything. So it will be easier for the people who have attended yesterday's class. Please answer. I'm getting answer like Bhor Committee, then Kartar Singh Committee. Majority are saying it is Kartar Singh Committee, and which is the right answer here. Kartar Singh Committee is the one which suggested the multi-purpose worker scheme. Till then, this multi-purpose worker, whoever was doing the work, they were called as malaria workers. Even though they were termed as multi-purpose worker, but they were doing most of the malaria-related works. So that is the right answer. Boer committee, remember, it is about the health survey and the integration of the preventive. Sorry, Boer committee was integration of the preventive and curative health sciences. So that was about Boer committee. Srivastav committee told about the health assistant. Health assistant. And multi-purpose worker was by Kartar Singh committee. Moving on to the next question. Dietary changes advocated by WHO for prevention of heart diseases include all of the following except for heart diseases, which is not told by the WHO. That is the question. Option A, decrease in the complex carbohydrate consumption. Decrease in the complex carbohydrate consumption, reduction in the fat intake to 20 to 30% calorie intake, consumption of saturated fats be limited to less than 10% of the total energy intake, and reduction of cholesterol to below 100 mg per kilocalorie per day. Which is the right answer here? The question was dietary changes advocated by WHO for prevention of heart diseases include all of the following except means which is not told by WHO. So we all know which is a risk factor for heart diseases. A consumption of more fat related, fat in the sense saturated fats. If we consume more of the saturated fat, it can lead to atherosclerosis and the coronary artery diseases, etc. And thereby also the cholesterol level will also increase. So thereby we know from this options, we know that reduction of fat intake, yeah, exactly, reduction of fat intake is told by WHO. Consumption of saturated fats must be limited. Yes, that is also told by WHO. Reduction of cholesterol, that is also told by WHO. So here the right answer is decrease in the complex carbohydrate consumption. That is not told by WHO. WHO has told to increase the complex carbohydrate consumption. So here we need to know one thing. What are the complex carbohydrates? If you know that, it will be very much easy for you to understand the right answer here, because complex carbohydrates are whole grains, then vegetables, whole grains, vegetables, then oats, then peas, etc. All those things comes under complex carbohydrates, and we all know whenever a patient comes to us with heart disease, we tell them to eat more of whole grains and vegetables, to include more in the diet. So here the right answer is A. Some of you have answered it as A. That is the right answer. Next, moving on. 5 clean practices. You all know 5 clean practices which is included in the tetanus. Which is included in the elimination of neonatal tetanus. So what are these 5 clean practices, and which among the options does not come under that 5 clean practices, 5 C's of neonatal tetanus? Under the strategy which does not come. Option A, clean surface of delivery. Option B, clean hand of the attendant. Option C, new blade for cutting the cord. Option D, clean airway. Which is the right answer? I've already started getting answers, and we'll see which is the right answer. Now we all know for neonatal tetanus, which is a mode of spread, it is mostly through the umbilical stump. Umbilical stump is the route of entry for neonatal tetanus. So from which all areas can the pathogen enter the body? It can be from the hands of the attendant or whoever is taking the delivery. So the clean hand comes under the 5 clean strategies. Next, new blade. If the blade is not new one or not sterilized one, then the baby can get tetanus infection. Clean surface. If the place where the delivery is taking place, if it is not clean, then also the baby can contract the tetanus. Then the other one, it is not told over here. 2 things. Cord care. Cord care. After cutting of the cord, if the cord is not taken care properly, then the baby can get tetanus. And the last one is cord tie. The cord tie should be clean, and there should not be any other application. In the sense, some places they apply turmeric over the umbilical stump to, in the hope that it will get healed properly. So one option here, that is the clean airway, that is the, as you all have said, that is the right answer, because airway does not come under the neonatal tetanus. So that is the right answer. Many of you answered correctly. Next question. The following statements are true about intrauterine devices except, which is a wrong statement here. Multi-load copper 375 is a third generation IUD. or the pregnancy rate of lipase loop and copper T200 are similar, or IUD can be used for emergency contraception within 5 days, or levonorgestrel releasing IUD has an effective lifespan of 5 years, which is the wrong statement here. I'm already started getting answers here that multi-load copper 375 is a third generation IUD. As we all know, what is third generation IUD? Third generation IUD is the hormone releasing IUD. Hormone releasing IUD is the third generation. Copper 375, copper releasing ones come under the second generation. Second generation IUD is the copper 375. So the right answer over here is A. Multi-load copper 375 is a third generation IUD. That is the wrong statement over here because that is a second generation. Now, moving on to the next question. The following statement about the breast milk are true, except which is the wrong statement. First one, the maximum milk output is seen in the 12 months. Option B, the coefficient of uptake of iron in breast milk is 70%. Option C, calcium absorption of human milk is better than that of cow's milk. Option D, it provides about 65 kilocalories per 100 ml, which is the right answer here. So I've already started getting answers. Some of you are telling C is the right answer. Some of you are telling A. So right answer here is A because maximum our milk output is seen at 5 to 6 months, not at the 12th month. It is in the 5 to 6 month that the maximum milk output is seen, not at the 12th month. So this is the wrong statement over here. So here A is the right answer. Moving on to the next question. The current recommendation of breastfeeding is that option A, exclusive breastfeeding should be continued till 6 months of age, followed by supplementation of additional food, or is it 4 months? Or option C, colostrum is the most suitable food for a newborn baby, but it is best avoided in the first 2 days. In the first 2 days, the colostrum should be avoided. Or the last option is that the baby should be allowed to breastfeed till 1 year of age. Which is the right answer? Option A, B, C, or D. Which is the right answer here? According to the health rules, yeah, I've already started getting answers over here. Many of you are telling A is the right answer. Exactly, A is the right answer. So nothing much to explain over here. Exclusive breastfeeding should be continued till 6 months. That is the current recommendation. Moving on to the next question. A 10-month-old child weighing 8 kg has Bitot spot in both eyes. Which of the following is the most appropriate schedule to prescribe vitamin A to this child? So here the child is 10 months old and weighs around 8 kg and has Bitot spot. So obviously the child will require vitamin A supplements. So when should we give it and how much should we give it? Is it 2 lakh intramuscular on day 0 and 14, or 1 lakh intramuscular on day 0 and 14, or 2 lakh intramuscular on 0, 1 and 14, or 1 lakh units intramuscular on 0, 1 or 14? Which is the right answer here? I started getting answers like D, which is the right answer because vitamin A for a child who is about 12 months If the child is above 1 year of age, then the child should be given 2 lakh, 2 lakh unit. If the child is below 12 months, then the child is given 1 lakh. Remember this thing. If the child is below 1 year, then it should be 1 lakh unit. And how much frequently, that is fixed because it should be given on 0, 1 and 14 day. So the right answer here is D. But it's not B. Some of you answered as B and some of you are A. So remember this thing. Yeah. Moving on to the next question. All of the following statements about leprosy are true except option A. Multibacillary leprosy is diagnosed where there are more than 5 skin patches. Option B. New case detection is an indicator for incidence of leprosy. Option C. Defaulter is defined as a patient who has not taken treatment for 6 months or more. Option D. The target for elimination of leprosy is to reduce the prevalence to less than 1 per 10,000 population. Which is the right answer here? The right answer here will be something which is not true about leprosy. Remember to always check the question, double check the question, as many of us forget to see the except part of the question. So leprosy, which is not true about leprosy. Please answer the chat box. I'm getting answers as A, B, D, etc. The right answer here, remember, it is C. C is the right answer here because default is a term which is used in TB, not leprosy. Such questions are there to confuse you. Remember, defaulter is there in TB, not leprosy. Defaulter, the meaning of defaulter means a person who has TB means they have tested positive for the TB by sputum smear examination, but he has not undergone treatment for more than 2 months, or at least 2 months. So that is the right answer here. So C is the right answer. Only one person has answered correctly. Next one, moving on. All of the following are the mode of transmission of leprosy except option A, breast milk. Option C, insect bite. Option B, transplacental spread. And option D, droplet infection. Which is the right answer here? Breast milk, insect bite, transplacental spread, or droplet infection. Many of the questions when it comes from community medicine, it will be like this, like accept this, accept that. So remember to double check the questions. So which is the right answer? Many of you have answered. Some of you have answered correctly. It is transplacental spread. Now, some of us will be confused as insect bite. Although it is rare, insect bite is a mode of transmission of leprosy. Remember that. The leprosy, the mycobacterium leprae can stay alive in the saliva of Anopheles mosquito for at least 150 hours. So, C is the right answer. Transplacental spread is not possible in leprosy. Now, moving on to the next question. The most appropriate test to assess the prevalence of tuberculosis infection in a community is, remember, it is prevalence, not incidence or diagnosis, it is prevalence. First one, mass miniature radiotherapy or sputum examination or tuberculin test or clinical examination. Which is the one which is used to see if the TB infection is present in the population or not. I've started getting answers like C. Exactly, C is the right answer. Remember, sputum examination is a diagnostic test. It is a diagnostic test. Tuberculin is the one which is used to assess the prevalence. Tuberculin test is the one we use to assess the prevalence of the infection. And mass initial therapy is not feasible. We all know. No. Moving on to the next question. The following statements are true about DPT vaccine, except first option, aluminum salt has an adjuvant effect. Option B, whole killed bacteria of Bordetella pertussis has an adjuvant effect. Option C, presence of acellular pertussis component increases the immunogenicity. Or option D, presence of Haemophilus influenzae type B component increases its immunogenicity. Which is the right answer? A, B, or C, or D? Which is not true about DPT vaccine? It's a double negative question, so remember, which is not true. Yeah. Please answer in the chat box. I started getting answers like B and D. So the right answer here is D. D is the right answer. The aluminum salt, we all know when we studied about DPT vaccine, we know the adsorbent which is used in the production of DPT, mainly diphtheria toxin vaccine, toxoid, is aluminum hydroxide. Aluminum hydroxide is used. So obviously it will have an adjuvant effect. Then DPT vaccine, obviously it has the pertussis component. So presence of this acellular pertussis component will increase the immunogenicity. And also even though it is the whole killed bacteria of Bordetella pertussis, it will also have a adjuvant effect. I mean it increases the effectivity. But Haemophilus influenzae type B, which comes along with the DPT, then Haemophilus influenzae type B and hepatitis B vaccine in the pentavalent vaccine. In case of pentavalent vaccine, this Haemophilus influenzae type B does not have any effect on the DPT vaccine. It just acts as a different component, not together. So remember that pentavalent vaccine, the components of pentavalent vaccine. So yeah, D is the right answer here. Some of you have answered correctly. Moving on to the next question. A 3.5-year-old child has not received primary immunization. So here we have a child who has never received any vaccine. Which of the following is the best vaccination advised to such a child? So a child comes, 3.5-year-old, without any history of vaccination. Which is the vaccinations which are given? So here we need to know which are the basic vaccinations and when it is given and how it is given. So the options are BCG, DPT1, OPV first dose, DPT second and OPV second dose after 4 weeks, or option D is BCG, DT, OPV1, measles and vitamin A, and option C, BCG, DPT1, OPV1, measles and vitamin A. Option D, DT, DT1, 2, and booster after 1 year. Which is the vaccine which is advised to a child who has never received any kind of vaccination? So the basic vaccinations in the EPI program, expanded program for immunization, that you need to remember. Which are the ones which is included there? So yeah, many of you are answering like B, D, A, and everything. The right answer here, remember, it is C. So basic vaccinations. Rajesh has answered correctly. It is C. BCG is the right option. BCG, DPT1, OPV1, measles, and vitamin A. Here it is incomplete because measles and vitamin A is not included. B is also incomplete because pertussis is not included here. And here the BCG is not there. So C is the right answer. These are the basic vaccination which has to be advised to the child. So moving on, the next question. Orthotolidine test is used for detecting chlorine, nitrites, or ammonia. Which is the right answer here? It is a very direct question and everyone can answer it very easily. Which is the right answer here? Please answer in the chat box. Is it chlorine or nitrates or nitrites or ammonia? A, B, C or D? Orthotolidine test. Short form we say it OT. It is used for detecting which one? I'm getting answer like A, B, C and everything else there. So right answer here is chlorine. It is used for detecting chlorine, free and residual chlorine. But as you all have answered and told like nitrites, yeah, nitrites is also has also given the positive orthotolidine test result, but it is not the purpose of orthotolidine test. Orthotolidine test, the purpose of it is detecting the chlorine and free and residual chlorine, not nitrates. One more thing you need to remember, the color which has been asked few years back, it is yellow color. And one more thing you remember, uh, only chlorine is detected in orthotolidine arsenate test. Now, moving on to the next question. True about Asha. Mental health worker involved in minimum need program, deployed 1 per 1,000 population, or to replace Anganwadi worker in ICDS. Which is the right answer? Is Asha a mental health worker or involved in minimum need program or deployed in 1 per 1,000 population or to replace Anganwadi worker in ICDS? Which is the right answer here? I've already started getting answers like C. Yeah, exactly. C is the right answer because we all know Asha is not a mental health worker. As the name suggests, he is a social health worker. And minimum need program, no. Asha is not involved in minimum need program. Neither does she replace the Anganwadi worker. And this one is correct answer. She is deployed 1 per 1,000 population. Next question. Which of the following statements about lepromin test is not true? Remember, it is not true. Option A, it is negative for most children in first 6 months of life. Option B, it is diagnostic test. Option C, important aid to classify type of leprosy disease. Option D, BCG vaccination may convert lepra reaction from negative to positive. Which is the right answer here? Is it A, B, C or D? I'm getting mixed answers over here. Right answer here is B, because as we have studied in medicine also and pathology also, microbiology also, lepromin test is a it's not a diagnostic test, but it's a prognostic test. So B is the right answer. It is a prognostic test. Moving on to the next question. Many of you have answered correctly also. Next one. Under WHO Vision 2020, The safe strategy is adopted for which of the following disease? Trachoma, glaucoma, diabetic retinopathy, or onchocerciasis. This was also dealt yesterday, and I'm going to explain it correctly and explain detailedly. Under Vision 2020, the safe strategy or safe strategy is adopted for which of these following diseases? You can answer the chat box. Already started getting answers. The glaucoma, trachoma, everything. So right answer here is trachoma. A is the right answer here. Safe strategy means safe, SAFE. S for surgery, then A for antibiotics, F for facial cleanliness, As we all know, trachoma is a skin disorder also, and E for environmental change. Remember, this thing is adopted for trachoma. Trachoma has safe strategy. And the other diseases which come under Vision 2020, I will just say it. Cataract. For cataract, the strategy which was given by WHO is surgical intervention. And for next disease is childhood blindness. For childhood blindness, WHO has told about vitamin A prophylaxis. And for other diseases are refractive errors. For refractive errors, clinics, the optometric clinics in PHCs were established. And for corneal blindness, eye banking was started. Then for diabetic retinopathy, awareness was conducted in public level. And for glaucoma, screening was undertaken. Screening for hypertension and the glaucoma was undertaken. So safe strategy is coming under trachoma. So moving on to the next question. The best indicator for monitoring the impact of iodine deficiency diseases control program is A. Prevalence of goiter among school children, urinary iodine levels among pregnant women, neonatal hypothyroidism, or B. Iodine level in soil, which is the right answer. Best indicator for monitoring the impact of iodine deficiency disorders, which is the best indicator. Any disease in the country or any public platform, first where it is seen in the newborns. Yeah. Dr. Chandni, Dr. Nirupama has already answered it correctly. It is C. Neonatal hypothyroidism. Neonatal hypothyroidism is the right answer. Whatever diseases are there which affects the whole community, it is first reflected in the health of the newborn. So that is the right answer here. Moving on to the next question. The diagnostic power of a test to correctly exclude the disease, remember it is correctly exclude the disease, is reflected by sensitivity, specificity, positive predictivity, or negative predictivity. So which is the right answer here? Diagnostic power of a test to correctly exclude the disease is reflected by sensitivity, specificity, positive predictivity, or negative predictivity. Started getting answers like sensitivity, then positive predictivity. Right answer here is D, negative predictivity. Remember, it is to exclude. To exclude a disease, obviously we have to know who are the true negatives. Who are the true negatives of the test. Then only we'll understand, we can exclude the disease in that particular person. So the right answer here is D, negative predictivity. Some of you have correctly answered also. Dr. Rajesh and Dr. Ravi have already answered it correctly. It is negative predictivity of the test with which we can exclude a disease. Moving on to the next question. Yeah, this is just another very important question I asked again. What is the color coding of a bag used in the hospitals to dispose the human anatomical waste, such as body parts? Yellow, black, red, or blue? The color coding of waste disposal system you have to know by heart because you are all doctors and you have been posted in all of the different health institutions, and there this is practiced very religiously. So, which is the right answer here? Exactly, yellow. A is the right answer. Yellow is the one which is used to dispose of human anatomical waste. It's the body parts. Other than that, cottons, then gauzes, then infectious waste, anything which has come in contact with the body fluids can be disposed in the yellow. Black, it is for the cytotoxic substances, cytotoxic drugs and chemicals. That is for the black. Red for the plastic. Blue is for the glass. And there is one more, white. White is for the sharps. With this, you need to remember one more thing. How is it disposed of? The waste in the yellow bags are disposed by incineration. Incineration, that is, it is burnt off. Or else it can be buried deep burial. Black, they are just disposed of like that only. And red means the plastic ones. First it is disinfected. Red and blue both are together, has the same disposal. Is disinfected, then is recycled. And white means sharps are autoclaved and reused or recycled. Yes. Moving on to the next question. Chlorine demand of water is measured by Horrocks apparatus, chlorimeter, double pot, or Bergfeld filter. Which is the right answer here? Chlorine demand of water. Remember, it is chlorine demand of water. Which apparatus is used, or which instrument is used to measure the chlorine demand of water? All these are getting answers as Horrocks apparatus. Exactly, Horrocks apparatus is the right answer. Horrocks apparatus is used to measure the chlorine demand. Remember, chlorimeter, as the name suggests, it helps in measuring the chlorine content of the water or the fluid. Chlorine content is told by the chlorimeter. Double pot, it is a method for chlorination of well. And Bergfeld filter is the small filter which we find in the filters. It's just a form of filter. Moving on. Next question. The recommended daily energy intake for an adult woman with heavy work. Remember, it is an adult woman and heavy work is 1800, 2100, 2000 or 2900. Which is the right answer? Remember, all these are in kilocalorie per day, okay? Energy intake. No? Which is the right answer here? The recommended daily energy intake for an adult woman with heavy work. I've been getting answers like 2100 and 2300. Remember, for adult woman with heavy work, it is 2900. With heavy work, it will be 2900. Just before going to the exam, make sure to read the table which is given in your Park textbook. 2900 is the right answer. Or if you want a precise value, it is 2925 kilocalorie per day. That is the right precise value. Now, moving on to the next question. The following tests are used to check the efficiency of pasteurization of milk, except which of the following test is used to see if the pasteurization was efficient or not. Phosphatase test, standard plate count, coliform count, or methylene blue reduction test, which is the one which is used to see if the pasteurization is complete or efficient or not. Except it is not used. Remember, except term is here also. Even I missed it here. Remember, while answering this, I think some of you have answered correctly, Dr. Chani, Dr. Arun. Yeah. Methylene blue reduction test is the right answer. Why? Because methylene blue reduction test, it is used to detect the microorganisms in milk. When it is done, it is done before. It is done before pasteurization. Before pasteurization is done, not after. So all the other tests, that is coliform test, standard plate count, and phosphate test, is done after pasteurization to see if the process was complete or not. Yeah. So moving on to the next question. All of the following methods are anti-larval measures except, they also except comes, which is not a anti-larval method. That is the question in short. Is it intermittent irrigation, Paris green, Gambusia affinis, or malathion? Gambusia, you need know the fish. Paris green is the chemical. Malathion is also a chemical. Intermittent irrigation is a physical method. Irrigation means water. Yeah, many of you have already started answering as I'm getting mixed answers over here. So, anti-larval method, which is not an anti-larval method, is except. The right answer here is it is malathion. Malathion is the right answer. Malathion is used to kill the adult mosquitoes. It is used to kill the adult mosquitoes. The anti-adult measures, not the anti-larval measures. All the others are used for the larvae, not the malathion. Moving on to the next question. Which of the following viral infections is transmitted by tick? Again, in the beginning, one question was there, right? The same kind of question again is asked. Which of the following viral infection is transmitted by tick? Is it Japanese encephalitis? Is it dengue fever? Is it Caseino forest disease or yellow fever? Which is transmitted by tick? This is a very easy question because we have been studying from our 12th and 11th standard only. Same thing. Again, they have been asking in our UG also. Okay, in PG also you will be able to study the same thing. Many of you have answered it correctly. It is Caseino forest disease because we know Japanese encephalitis it is by Culex mosquito. Dengue fever it is by Aedes mosquito. Yellow fever is also by Aedes mosquito. And Caseino forest disease is by hard tick. The right answer here is C. Many of you have answered it correctly. Moving on to the next question. Which one of the following statements about the influence of smoking on risk of coronary artery disease is not true? Option A. Influence of smoking is independent of other risk factors of CHD. Option B, influence of smoking is only additive to the other risk factors of CHD. Influence of smoking is synergistic to other risk factors for CHD, or influence of smoking is directly related to number of cigarettes smoked per day. Which of the options are not true? Here you have to read the options carefully and correctly and process it properly. Then only you can answer such questions, because these questions are there to confuse us. So each by one you have to see, is the influence of smoking independent of other risk factors CHD? Yes, it is. Influence of only smoking can increase the risk for CHD, that we know. By logic, we know smoking increases risk for heart disease, that we know. Next one, smoking is only additive. It is additive to other risk factors for CHD. It's only an additive factor. Only smoking does not have any issue on CHD. That is the statement, which we know is not true. So here we get the answer as B. B is the right answer. We know that smoking, if a person is a chronic smoker, then plus he has any other hypercholesterolemia effect, then the person can develop CHD. Thereby, the option C becomes a true one, because it is synergistic, means it acts together with something else. And this is a common one related to number of cigarettes smoked per day. That is also right. So here B is the right answer. It is not an additive, it is a synergistic effect. It has a synergistic effect, not an additive effect. Now moving on to the next question. All of the following statements are true about congenital rubella except option A, it is diagnosed when the infant has IgM antibodies at birth. Option B, it is diagnosed when the IgG antibodies persist for more than 6 months. Option C, most common congenital defects are deafness, cardiac malfunctions, and cataract. Option D, infection after 16 weeks of gestation results in major congenital defects, which is the wrong statement here. This is also a very simple question if you know the pathology of rubella and the pathogenesis, which you will be learning in pediatrics also the coming days. So, next one, yeah, which is the right answer here? Please answer in the chat box. Yeah, I've already got the right answer. It is D. Infection after 16 weeks of gestation results in the major congenital defects. That is the wrong statement over here. Why? Infection before or in the first trimester. First trimester has the major congenital defects. After 16 weeks, there is no major congenital defects that we know. In the first trimester is the main portion where the congenital defects develop in the child. So remember, D is the right answer here. Many of you have answered it correctly. Moving on to the next question. All of the following are true about herd immunity for infectious diseases except herd immunity for infectious diseases except option A, it refers to group protection beyond what is afforded by the protection of immunized individuals. Option B, it is likely to be more for infections that do not have a subclinical phase. It is affected by the presence and distribution of alternative animal host. Option D, it in case of tetanus, it does not protect the individual. All of this are true except what? Which is a wrong statement over here. So what is herd immunity? Well, herd immunity is used for mass vaccination and everything. So in case a person is vaccinated, he goes and transmits the subclinical infection to the other person, whereby that person also develops antibodies and is immunized by active method. Which is the right answer here? Exactly, many of you have answered correctly. It is B. Why? A subclinical phase has to be present. Subclinical phase has to be present for the development of herd immunity. If not, there won't be any herd immunity. Remember, that is the right answer here. So, moving on to the next question. Endemic disease means what? Means option A occurs clearly in excess of normal expectancy or is constantly present in a given population group. Option C exhibits seasonal pattern or D is prevalent among animals. What is the right answer here? This you can answer it easily because this comes in organ and also what is endemic disease? The definition of endemic disease needs to be known to answer this question. Yes, I've already started getting answers as B exactly. B is the right answer. Endemic disease is a disease which is constantly present in a given population group at any time. If you see a population, there will be some one or other case of the particular disease. That is called an endemic disease. Next one. Moving on to the next question. Which one of the following is a good index of severity of an acute disease? This question was asked 2 years back or last in AIAPGET, and it has been asked many a times in PSCs also, which indicates the severity of an acute disease. Severity of an acute disease. Is it cause-specific death rate? Is it case fatality rate? Standard mortality ratio or 5-year survival? Now, in case of COVID, you can say, why is COVID so much severe and so much cared upon? Because it is effective in causing death to many, like most of the population who was affected. So here the right answer, as you all have correctly said, it is case fatality rate. Case fatality rate is the right answer. I don't have to explain it. Yeah, Dr. Sani Singh has correctly said it was asked in 2018 question paper. Now moving on to the next question. Infant mortality does not include what? Option A, early neonatal mortality, perinatal mortality, post-neonatal mortality, or late neonatal mortality. Which is the right answer? Infant mortality. Yeah, many of you have correctly answered. I don't have to explain it in detail again. It is perinatal mortality. I'm not going to explain in detail about this. Previous question in the sense, why not? Standardized mortality ratio. It is, yeah, it does have a if means effect on understanding the index, understanding the severity of acute disease. But here the question is specifically asked, which is a good index. Means when such questions are asked, we have to choose the option which is most apt, most appropriate in the scenario. So here fatality rate, as the name suggests only, it suggests any case which can go into, see why not? Yeah, so here the most appropriate answer is case fatality rate. So that is why C is not the answer here. B is the answer here. Okay. So here also, this one, perinatal mortality is the right answer. And if you have to explain the other ones, late neonatal mortality will start with. It is from 7 days to 28 days. If death occurs, if the child dies within 7 to 28 days of birth, then that is considered a late neonatal mortality. Post neonatal mortality, it is 28 days to 1 year. And early neonatal mortality, in the sense it is 1 week within the 1 week in 7 days, within 7 days. So that you have to remember. And infant mortality, we all know it is below 1 year. Any child who dies, if the child dies below 1 year, it is considered a neonatal mortality. So here perinatal mortality doesn't come because here it is perinatal, means it is 28 days, 28 weeks of life, of intrauterine life to birth. It is 1 year of life, okay, 1 year of life. This intrauterine life. After birth, if it comes, then it is considered under infant mortality, not before that. I hope I am clear about the previous question also. Now moving on to the next question. In all of the following diseases, chronic carriers are found except measles, typhoid, hepatitis B, or gonorrhea. Which is the right answer here? In which disease chronic carriers are not found? That is the question. Please answer this in the chat box. The right answer here, exactly, many of you answered correctly. It is measles. Measles is the right answer. We all know typhoid has a chronic carrier. Hepatitis B also has a chronic carrier, and gonorrhea also has a chronic carrier. But measles does not have a chronic carrier, even though it has a chronic complication which develops after 25 years. But still, they are not a carrier. Once it is done, it is done. Moving on to the next question. All of the following indicators are included in physical quality of life index, means PQLI, except infant mortality rate, life expectancy at age 1, in literacy rate, or per capita income. Which is the right answer? Please answer chat box. Yeah, I was asked about the herd immunity question, right? So in herd immunity questions, the options were the option C was affected by the presence and distribution of alternative animal host. See, in case a disease has an alternative animal host, obviously there will be an effect over the total disease burden. So that answer is correct. That statement is true regarding herd immunity. Okay, but here, the correct answer was B, right? Means they do not have a subclinical phase. For herd immunity to persist, there has to be a form of subclinical infection. Subclinical infection means a person is not exhibiting a disease, but has a antibodies and antigen in his body. So after the vaccine is taken and the antibodies are produced in the body in the person may transmit that subclinical infection to other persons. Thereby the whole herd, the whole community will get immunized. So that is why B was the right answer here. There was a question, the question had except in that, right? So C is true about herd immunity. And B is false. That is why B is the right answer here. I hope I'm clear. So in this question, all of the following indicators are included in physical quality of life index, except many of you have answered it as per capita income, which is the right answer. Which is the right answer. All the other ones comes under PQLI. All the other ones does come under PQLI. Moving on to the next question. The highest percentages of polyunsaturated fatty acids are present in which oil? Groundnut oil, soybean oil, margarine oil, or palm oil. So, which is the right answer here? Which of the following oils has the highest percentage of polyunsaturated fatty acids? Please answer in the chat box. To answer this, you need to know the values, different values of oils and fatty acid concentration of the oil. I've already started getting answers like groundnut oil, then soybean oil. The right answer here is soybean oil, because soybean oil has around 55 to 58 percentage of PFAS. Now I'll give a not flow chart. I'll give a rough estimation. The highest is in safflower oil. Safflower oil has the highest, around 74 or 75 percentage of PUFA. Then comes the grapeseed oil. Then comes the grapeseed oil. Then comes the flaxseed oil. Then comes the sunflower oil. Then comes poppy seed. Sorry for the poppy seed oil, and then comes the soybean oil. So remember this ones: safflower, grapeseed, flaxseed, sunflower, and poppy seed, and then comes the soybean. All the other ones has lesser. Soybean is the right answer over here. Many of you have answered it correctly. I'll move on to the next one. Which of the following is an example for disability limitation? Reducing occurrence of polio by immunization, arranging for schooling of children from PRPP. Option C, resting affected limb in neutral position, or providing calipers for walking. Which is the right answer here? Which is the right answer? Which is a form of disability limitation? Now, we all know disability limitation is a form of tertiary prevention, when the disease has already established itself in the person. So then we do disability limitation and rehabilitation. Disability limitation and rehabilitation. So here, reducing occurrence of polio by immunization, we all know it is a form of primary prevention. Primary prevention, and it is not a disability limitation. Arranging for schooling of children suffering from PRPP. PRPP, paralytic polio. Paralytic polio. It is not auxiliary. This is a form of rehabilitation. It's a form of rehabilitation. Next one, resting affected limbs in neutral position. This one we know what this does. This helps in reducing the paralytic effect, the deformities. Deformities are reduced. So this one we know is a correct answer. Many of you have answered it correctly. This is the right answer here. Providing calipers for walking is also a form of rehabilitation. C is the right answer. Now moving on to the next question. Following statements are true regarding leptospirosis, except first one is a zoonosis. Man is a dead-end host. Man is an accidental host, or lice acts as reservoirs of infection. Which is the right answer here? We all know leptospirosis is a zoonotic infection. So this one is true. Man is a dead-end host. Exactly. Man is a dead-end host. Man does not transmit to other people or other organisms. So man is a dead-end host. Man is an accidental host. That is also true. Now here, lice acts as a reservoir of infection is the right answer here because this one is not true. What is a reservoir for leptospirosis? Rat. Rat acts as a reservoir for leptospirosis. So that is the right answer for this question. We'll move on to the next question. Some of you answered correctly. Dr. Ravi answered this correctly. Next, moving on. It is true regarding endemic typhus that man is the only reservoir of infection. Flea is the vector of the disease. Rash developing into eschar is characteristic presentation. Or culture of etiological agent and tissue culture is diagnostic modality. Which is the right answer here? Earlier, while dealing with the vectors, I had told endemic typhus is transmitted by flea. So from that knowledge, we know B is true. So once we get a true statement, we don't have to cut into the other ones. So B is the right answer here. Okay. And just explain the other options. Man is the only reservoir for infection, which is not true because flea also acts as a reservoir of infection. Rash developing into eschar is a characteristic resolution. No, this is not true regarding endemic typhus. It is of the scrub typhus, not the endemic typhus. And culture of etiological agent in tissue culture is the serological, this is a diagnostic modality. It's also not true. Serological test is the diagnostic modality here. B is the right answer. Many of you correctly answered. We'll move on to the next question. Causative toxin for endemic ascites is pyrrolizidine, beta oxaloaminoalanine, ergot, or aflatoxin. Which is the right answer here? Which is the causative toxin for endemic ascites? So this portion of community medicine is also very, very, very important. It has been asked consequently in many of the exams, PSCs, and the this also PG exams also. It is very easy. Beta oxaloaminoalanine, we have been mugging up from UG onwards. That this is the cause for lathyrism. Ergot, we already know it is for ergotism. And aflatoxin, it is a cause for liver cancer, hepatocellular carcinoma. So the only one remaining is pyrrolizidine. This is the right answer here. So A is the correct option here. We'll move on to the next question. Active methods to detect undiagnosed cases in apparently healthy people. Which is the right answer? Case finding, surveillance, screening, or monitoring. So here, two things you have to know. It is to detect undiagnosed cases. To detect undiagnosed cases in healthy individuals. So, which is the ones which we do in healthy people to see the undiagnosed cases? Which is the answer? Please answer in the chat box. I've already started getting the answers as C. Exactly. C is the right answer here. Because screening is the one we do in healthy people to see whether they have the disease or not. So C is the screening is the right answer. Monitoring and case finding and surveillance is not done on the healthy people. Not healthy people, it is not the right answer here. Now moving on to the next question. Efficiency of a goiter control program can be assessed using. So this is the same question which we, similar question which we dealt some questions back. Efficiency of goiter control program can be assessed using what? Neonatal thyroxine levels, goiter in pregnancy, goiter in age group of 12 to 18 years, or soil iodine levels. The same question, slightly modified, and this is given. Which is the right answer here? Exactly. Some of you answered correctly already. A is the right answer. See, efficiency of any program, it has to be has to be assessed in children. It's the neonates. Neonates are the ones who are deeply affected, and they give the accurate values to see if it is efficient or not. So many of you have answered it correctly. This is the right answer. Moving on, all of the following. This was dealt, so I'm not dealing it again. Same question. The right answer here is again per capita income. This was dealt already. Moving on to the next question. Any loss or abnormality of psychological, physiological, or anatomical structure or function is known as disease, impairment, disability, or handicap. Which is the right answer here? This was dealt yesterday. Ma'am had taught you yesterday. Same thing. Impairment, disease, disability, or handicap. Any loss or abnormality of psychological, physiological, anatomical structure or function. Which is the thing? Answer here. I've already started getting answers, but majority of answers are telling us C. But no, C is not the answer here. The answer here is B. Impairment. Impairment is the 1 second. So here the right answer is B. B is the right answer. Impairment is the right answer. So disability means what? Disability means what? Disability means it results from the impairment. First disease occurs, then impairment occurs. Because of the impairment, if there is a um, restriction, if the ability to perform an action is lost, this this inability to perform an action because of the impairment is called as disability. So this is the definition of impairment as such. Remember that. Now moving on to the next question. Vision 2020. Vision 2020, the right to sight includes all except glaucoma, epidemic conjunctivitis, cataract, or onchocerciasis. Which is the right answer here? I had already explained it earlier when we were dealing with the SAFE strategy. So from that we know trachoma is considered under Vision 2020. So which among the options is not included under Vision 2020? So under Vision 2020, I'll write over here cataract, then trachoma, then onchocerciasis, then childhood blindness, then refractive errors, These are the major ones which are considered under Vision 2020. There are others also like diabetic retinopathy, then corneal blindness, that is also considered under Vision 2020, but these are the major ones. So here, epidemic conjunctivitis, many of you have answered it correctly. Epidemic conjunctivitis does not come under Vision 2020. Remember that. Moving on to the next question. Richest source for vitamin D is what? Among the following questions, following options, which is the richest source of vitamin D? Milk, egg, green leafy vegetables, or fish oil? Remember one thing, milk is not that good source of vitamin D. Egg, in egg also, the yellow portion of the egg yolk, that is, sorry, not yellow, egg yolk. Egg yolk is the source for vitamin D, not the albumin bar. Green leafy vegetable is a source, but it's not a richer source. So right answer here is fish oil. Fish oil is the right answer, as many of you have correctly told over here. Moving on, I will have to explain this. Before going to the exam, do remember to check the sources of all the vitamins, because that is asked many times. At least one of the vitamins will be asked. Next, moving on. Disease not transmitted by lice is. Okay, similar question. Disease not transmitted by lice. Very much easy. I don't have to explain it in detail again. We all know the right answer here is Q fever. All the others are transmitted by lice. So, moving on to the next question. Brucella is transmitted by all except. So from these questions, you might have gotten idea to study the vectors and transmissions. So remember to brush your knowledge on these aspects. Which is the right answer here? Is it aerosol transmission or ingestion of raw milk, man to man, or contact with aborted fetuses? Which is the right answer here? Exactly, many of you have answered correctly. It is man to man. In Brucella, there is no man to man transmission. Okay. Moving on. Which of the following characteristics is not of much importance in a screening test? First one, low cost, high safety margin, high sensitivity, or high specificity. This question in a different form, we have dealt it already. I don't have to explain much in this one. Earlier, while dealing about this screening test, we have dealt it, and you all had answered it earlier. Please answer this question. Which of the options is not important in screening test? So we all know screening is a mass strategy. So any test, the test which is done has to be of a lower cost. So that is the right answer. Safety margin, it has to be highly safe to conduct the test. So that is also correct. Highly sensitive. The screening test has to be highly sensitive. That is exact. That is true. Otherwise, we won't be able to understand who has a disease and who doesn't. Highly specific. That is the wrong one here. Because for a screening test, we already saw that specificity is not important. So D is the right answer. Some of you have answered correctly. Now moving on to the next question. Thiamine deficiency is seen in all except in the following question options. In our following options, thiamine deficiency is not seen. In which one thiamine deficiency is not seen? Option A, chronic diarrhea. Option B, chronic alcoholism. Option C, homocystinemia or food fetish. You will be knowing most of the terms, but one thing you need to know is food fetish. Who is a food fetish? Food fetish is someone who just unethically propagates and also practices diets, the normal dieting we say, no, irrespective of any nutritional value or anything, they just go on not eating food or like irrational diet habits. Those are the people who are told as or called as food fetish. Now I have already started getting answers like C. Exactly, C is the right answer. Homocystinemia is the right answer here. Chronic alcoholism and chronic diarrhea and food fatigue, these people will have thiamine deficiency. Okay, moving on. And one more thing, homocystinemia, these people will have not thiamine but vitamin B12 and also some cases vitamin B6 deficiency also, not thiamine. Okay, moving on. Which of the following is not an accepted method for randomization? So in RCT, we know the cases, the people or the subjects have to be randomized to reduce the bias. So which is not an accepted method? Option A, computer drawn randomization. Option B, odd or even day hospital admission. Option C, lottery. Or option D, random number table. Which is the right answer? I'm getting mixed answers over here. The right answer here is B, not C, because lottery is an accepted method. Some of you might be shocked hearing this, but lottery is an accepted method. If you go back to your Park textbook and read lottery, computer on randomization, and random number table is also given under the um, reduction, sampling and the randomization under the RCT. Okay, moving on to the next one. Which of the following statement about lepromin test is not true? Remember, it is not true. This we have already dealt. I don't have to. You can explain it again. We know that lepromin test is a test, not a diagnostic one. Okay. Moving on to the next one. Which of the following is the least common complication of measles? This is a very easy question. We This is a very much favorite question of most of the examiners when they go for Viva. When we go for Viva, this is usually asked. It's the least common. Remember, it is least common. Diarrhea, pneumonia, otitis media, or SSPE. SSPE is subacute sclerosing panencephalitis. Uh, Already many of you answered correctly. It is SSP. SSP. This is the right answer. All the others are common ones. And next one. Which IUCD acts for 10 years? This is another important topic which you have to read at least once before going to the exams. IUCD chapter. Which is the IUCD which acts for 10 years? You need to know which is what IUCD, which comes under which generation, and also you need to know the duration of action. I have already started getting the answers as C, which is the right answer. Copper T380A, which is the most commonly used one in present days, this acts for 10 years. That is the right answer. Other ones, Nova T acts for 30 months. 30 months, that is around 3 years, right? And copper T, multi-load 250 acts for around 3 years also. This is also around 30 months only. So copper T 380A is the one which acts for 10 years. That is the right answer, as many of you have answered correctly. Next question, sorry. All can be incinerated except cytotoxic waste, sharps, anatomical waste, or infectious waste. Which of the following cannot be incinerated, which cannot be burnt? Which is the right answer here? I had already explained it while telling about the color coding system of the waste disposal. We know cytotoxic waste is the yellow bag, sharps is in the white bag, white tin, anatomical is, sorry, cytotoxic is under black, sorry. Anatomical is in the yellow, infectious is also in the yellow. And we know yellow ones can be incinerated, but sharps cannot be incinerated. We can't Exactly, Dr. Chandni, it is autoclaved. Sharps is the right answer. Sharps is the right answer. Some of you answered as B. Yeah, many of you answered as B, which is the right answer. Next one. Compared with cow's milk, mother's milk has more of what? Lactose, vitamin D, protein, or fat. Which is the right answer here? Compared to cow's milk, mother's milk has more amount of what? Lactose, vitamin D, proteins, or fat. You already started getting answers like A, lactose. Exactly, lactose is the right answer. Lactose is the right answer here. Mother's milk has comparatively more amount of lactose than the cow's milk. Proteins and fat is in the required quantity in the mother's milk, but in the cow's milk it is present in excess quantity. Okay. Moving on, all are common cause of blindness in children in India, except which is not a common cause of blindness in India. Is it malnutrition, ophthalmoneonatal, glaucoma, or congenital acrocystitis? It's very much easy to answer. Which is the right answer here? We all know malnutrition is a very much common cause of blindness in children in India. That is why vitamin A prophylaxis has been started only. So remember, except has been asked, which is not a common cause of blindness. That is the question here. Ophthalmoneonatal is also a common cause of blindness. Congenital glaucoma is also a common cause of blindness in India. But congenital acrocystitis is not a common one. It is not common. It is a cause of blindness, but it is not common in India. That is why C is the right answer. Sorry, D. D is the right answer. D is the right answer here. Okay, Rajesh has answered it correctly here. Now, moving on to the next question. True about endemic typhus. Endemic typhus. This was already dealt in earlier. One question, the same question was asked. This is asked again here. Please answer. I don't have to explain it again here. True about endemic typhus. Man is the only reservoir of infection. Flea is the vector of the disease. The rash developing into eschar is characteristic of the disease. Culture is a diagnostic modality. Exactly. People are answering correctly. B is the right answer. I am not going to explain it again because I've already explained earlier. Moving on to the next question. The other major portion of community medicine which you have to revise, which is true of BCG vaccination, immunization chapter in general, yeah. Which is true of BCG vaccination. Distilled water is used as diluent for BCG, or site for injection should be cleaned with spirit. Mantox test becomes positive after 48 hours of vaccination. WHO recommends Danish 1331 strain for vaccine production. Which is right answer here? Which is the right answer in this one? Yeah, I've already started getting answers. Exactly, D is the right answer. D is the correct answer here because distilled water is not used. Normal saline is used as a diluent. Site of injection is should be clean with spirit. That is wrong because site of injection should be clean with normal saline. Mantox test becomes positive after 48 hours. That is wrong. It becomes positive after 8 weeks. So these things you have to remember. So D is the right answer here. Moving on to the next question. Strategies for prevention of neonatal tetanus include all of the following except 5 clean practices, giving penicillin to all the newborns, 2 doses of TT to all pregnant women, immunizing all married women. Which is the right answer here? Please answer in the chat box. As it's already 9 o'clock and I'm kind of exceeding the time. So should we continue today or continue with the rest of the questions? Almost 50 to 60 questions are remaining in the in the session today. Should we continue it tomorrow or finish it off today only? What do you people want? Please answer. Okay. So when you decide on that, I'll give the right answer over here. The right answer here is B, as you all have correctly said. B is the right answer. The 5 clean practices is given under neonatal prevention, neonatal tetanus prevention, and 2 doses of TT that we all know is given for pregnant women. Okay, so you all want it tomorrow, right? Okay, then we'll continue tomorrow. We'll finish this one. And immunizing all married women. Some of you answered that D. Sorry, D is not the right answer. According to the strategies for preventing neonatal tetanus, nowadays TT is not TT. The immunization is being started from the early age of marriage only. Sorry, early married life only. The women are being immunized so that the child later on in their child does not get any neonatal tetanus. Okay. With this, we finish today's session. Tomorrow, 7 to 8, almost 8, we'll finish with the MCQ session. Almost 50. If possible, I'll add some more questions. You want? No? Thank you. Stay safe, everyone. The cases are increasing day by day. And good night. If any doubts, you can ask in the chat box now or prepare your doubts for tomorrow and then ask. We'll try to answer as much as possible. Yeah. Good night. Thank you for listening.